who is Women and AIDS Support Network. We are an organization that looks at HIV and AIDS through gender lenses. Coming from a background where a lot of work has been done on HIV and AIDS with little resources, achievements have been recorded in Zimbabwe. However, achievements gained can be reversed if Zimbabwe's situation is not taken care of. The situation of HIV globally indicates that we have 38 million people living on HIV and AIDS. Of the above figure, about 30 million live in developing countries. Asia and Africa are included there. It is against this background that we realize that the need to have radical strategies in dealing with the pandemic for us to be able to harness it. Zimbabwe, like many other African states, is categorized as a developing country with little resources to deal with natural disasters. The pandemic has about 1.8 million people living with HIV and AIDS. Of the 1.8, above 900,000 people are women. About 3,000 people are dying every week. What is it that made us fail the 3 by 5? We had shortcomings or challenges, like poor service conditions that saw an exodus of health workers moving to greener pastures, either in the region or to the west. Amongst the reasons for poor conditions were mainly aged machinery, skills decay, and poor remuneration. There was also a shortage of drugs. The health worker-patient ratio and poor remuneration frustrated health workers, and HIV and AIDS made it worse, with approximately 70% bed occupants being people living with HIV. This resulted in the introduction of the home-based care, which I think is doing well to some extent. There was also the whole issue of inadequate resources in terms of finances to renovate the institutions. Also, developed countries that are poaching health workers, health personnel from developing countries have cut on their training budgets, leaving Africa and other developing countries as training grounds. Why don't they bring their training budgets to the training grounds? Without responding adequately to the challenges that we met when we're talking about the 3 by 5 initiative, we risk failing to meet our target by 2010. Issues of health are human rights issues.
Discrepancies in health financing speaks volumes to how human rights are violated, especially on issues of resource allocations to the African continent. Developing nations are often viewed as burden to the global resources by the first world. One would want to question whether it would have been better to be born a Japanese cow that receives subsidies to the tune of $4 per day for it to be able to produce dairy products that are sold worldwide, than to be born an African, and especially a Zimbabwean, who is expected to survive on $4 per annum in a country that is burdened by disease and institutions that are manned by frustrated health workers. It is against this background that Women and AIDS Support Network, Harare, National AIDS Council, and Zimbabwe AIDS Network decided to run these border posts advocacy activities on candlelighting memorial to conscientize communities about issues of health discrepancies in the struggle for survival.